South Texas, it's great to be with you again. I'm here to share with you today the plan that I've developed after my transition briefings. And I'll tell you, my first several weeks here were exhausting, to say the least, because I just couldn't get enough of the engagement with our employees, with our stakeholders, with our labor partners, with our congressional offices. It really was a lot to take in, but also just filled me with pride as I interacted with all of you and heard you tell me the things that you thought were great about this healthcare system, but also the input you gave me in terms of opportunities for improvement. So while it was tiring, I wouldn't have changed a thing. So here, if I had to summarize my assessment of the healthcare system, it would be that South Texas is a very good healthcare system, but it's positioned to be an excellent healthcare system. And that's based upon really four things that I took away from the transition briefings. One of which was the organization really had a consistent focus across all the areas that I spoke with, which I thought spoke a lot to consistency in the organization. And many of you saw the same strengths and saw the same opportunities, which I thought was very significant. Also had a lot of discussion about teamwork. You told me you felt like we had a strong teamwork culture in the organization. There was a clear passion for the mission in the organization with a 41% veteran employment rate. That told me that we've got the right people in the organization to make the right kind of changes that we need. And there was a significantly intense focus on clinical quality. Many of you were proud of the quality of care that we provide, but also had some input into what you thought we could do to take the provision of care to another level. So I'll go into a little bit more detail about again, like I mentioned, who I met with. So I had a number of meetings with different audiences. Those included some congressional staffers. We had an all-employee session here in Audie Murphy. I had a meeting with our labor partners. I went to Kerrville for another all-employee meeting there. I had another session with the executive leadership team. I had another session with our clinical leadership. Another session with our administrative service chiefs. And then we had two more sessions here in Audie Murphy, one with administrative frontline staff and then a separate session with clinical frontline staff. And so the takeaway from those conversations, as I mentioned, there were really 5 areas that were highlighted as top strengths for the organization. You all told me that the quality of care was a strength. You thought that our focus on customer service was a strength. You thought that teamwork in the organization was a strength. You thought that overall the culture in the organization was positive and headed in the right direction, so you noted that as a strength. And you felt like leadership in the organization was a strength. On the opportunity side, here are the 5 areas as I've sort of collated your comments, really collected them into 5 categories, and here's what those 5 categories were for opportunities. There's a lot of discussion about business opportunities, and that included a myriad of things from revenue-related functions to strategic planning-related functions to our business planning processes to, in some cases, space planning processes. There was some discussion about facilities, whether that was modernization of facilities or, again, utilization of space. I got a lot of comments about human resources and HR processes. There was discussion about succession planning in the organization and whether we were prepared when leaders or in some cases staff left their roles to have someone ready to step in. And last but definitely not least, you told me quite a bit about communication and that you didn't, all the communication feedback was diverse. The resounding theme was that you felt like there was a lot happening in the organization and you weren't always sure you knew and were aware of what was happening in the organization. So we'll talk a little bit about that. So the plan I put together, again, we'll call it the 180-day plan only because I've joined the organization mid-year and we've got roughly 6 months left in the fiscal year, which would equate to approximately 180 days. So we're calling this a 180-day plan because it is really my plan to help the organization close out FY19 and start fiscal year 20 on a solid footing to know what changes we need to make from that point going forward. And there are really 2 ways that I decided to develop this plan. One was on focusing on strengths. So the areas that you all told me were strengths for the organization, I also saw some of those strengths as opportunities and things that we should reinvest in or double down on to propel the organization to the next level. And then the other category is what I call strengthening critical weaknesses. So again, some of the areas that you all talked about more in the administrative or facilities realm that you thought from a, in many cases, clinical perspective were holding us back in either clinical outcomes, access, or performance. So we'll break these down in those 2 categories. So first we'll talk about the customer service culture, which I saw and what you all communicated as a strength. So there is a focus on customer service in the organization. All of you talked about how well you felt like between services you communicate, and there's a good attempt at teamwork to work together. You talked to me about how well you think veterans perceive customer service in the organization. So I think there are opportunities there to take the way that we treat our veterans and the way that we treat our staff to another level. Few VA facilities, but not many at this point, have actually started recruiting senior executives and what we're calling chief experience officers. They really have a dedicated focus on both the employee and veteran experience. We've got a lot of staff in the organization that are focused on some aspect of the veteran experience, but I think we would benefit from consolidating some of these resources and appointing a senior level leader that will report directly to me to help us focus on improving experiences in the organization. And again, that's not just experiences for our veterans, but it's also experiences of our employees who are our most valuable resource. So we are actively developing a position description for a chief experience officer. I'm expecting this to fall in the realm of an assistant director level, so likely GS-14, and that position, as I indicated, is planned to report directly to myself. There's going to be some service realignments, so we'll just hit a few of the services that I'm expecting to be realigned to this Chief Experience Officer, and then some of these are going to be processes that are going to be realigned to this Chief Experience Officer. So, for example, nutrition and food service, voluntary service, chaplain, recreation therapy, patient advocates, canteen, and our customer service office here are planned to realign to our Chief Experience Officer, but there's some other activities that I would expect to have our Chief Experience Officer get involved with and take ownership of, like our Red Coat Ambassador program. We're definitely going to be expanding that and using more than volunteers, but resourcing that long term. Our patient transportation activities and our valet program are also expected to realign under the Chief Experience Officer. Now, my expectation is to have this realignment done by September 30th, so we're going to be working pretty quickly to get the position classified and get it filled as quickly as possible. And I talked to you about the staff focus, and this is where I've asked as an organization, once we find the right candidate for the Chief Experience Officer, that we're going to put a lot of early emphasis in looking at what we're doing for our employees in the organization to ensure that you're truly not just choosing to come work at VA, but choosing to stay in the organization. So really looking forward to that increased focus. As this program develops and we get closer to actually filling the Chief Experience Officer, I'll keep you up to date with how that effort is progressing. The other area that you all talked to me about as a strength was the focus on clinical quality in the organization. And again, it's an area where I feel like we have a lot of really strong talent that right now are really working well together. But in order to take the organization where I truly believe we can be, I'm going to be consolidating some of these activities and actually building what we call the Quality Safety Value Service. Many of you know we do have an ACOS for Quality Safety Value, Dr. Evan Renz, but we have other functions in the organization like quality management, patient safety, our risk management functions, our systems redesign functions, and our performance improvement activities. We are going to be consolidating these into a single office that we'll be calling Quality Safety Value, really with the intent on helping us ensure as an organization that not only the existing level of performance continues, but if we can get a little bit more synergy from some of these activities, I believe this organization can easily be a five-star organization as measured through SAIL. So finishing up the Quality Safety Value discussion, this office will also be taking lead in our high reliability journey that I've talked to you about in a previous video, and deploying not just the training programs, but some of the principles that as an organization I'm going to expect to us deploy at all levels of the organization. And so our Quality Safety Value Service is going to be leading that effort for me, and I look forward to their success once we have that office established. Right now I'm looking at July, really no later than July, to have our Quality Safety Value Service stood up. And again, I'll keep you up to date as that effort progresses. And I am actually going to charter a formal, what I'm calling 5 in 5 clinical quality challenge. That means I think the South Texas Veterans Healthcare System, on our current trajectory, with the additional synergy that I expect us to get from Quality Safety Value, can achieve 5-star designation in SAIL within the next 5 quarters. So that's going to require a lot of effort, not just from quality, safety, value, but from our clinical leaders, obviously from our chief of staff, our associate director from patient care services. It's a heavy lift, but from what I've seen in this organization, we are capable of doing it. So I'm going to challenge you with that formally, and look forward to all of our success there. Okay, so now we're getting into strengthening critical weaknesses. So we'll start with our business and resource planning processes. This is what a number of you spoke to me about as it related to our strategic planning activities and business planning activities. There's going to be a lot of effort in the organization to refocus what we think our clinical and operational destiny needs to be. So I'll briefly go through the 5 steps that are covered under this particular action. First, through our Joint Leadership Council, I'm going to be charging several councils to reevaluate core functions. The one I'll choose to share with you today is I'm going to be charging our Clinical Executive Board to look at our clinical portfolio. As an organization, we're providing a lot of services. And I think as an organization, we need to determine which of these clinical services we're going to continue to grow, which of these clinical services we may decide to lock into their current footprint, and which of our clinical programs we may decide to sunset in order for us to grow other programs that we really see as either the future of healthcare or the future of our healthcare system, to ensure that the South Texas healthcare system is the most accessible healthcare system for the services that we choose to provide. Again, I think this is something that we can do, but it's going to require a lot of effort from our clinical leaders in the organization to give us these recommendations. Based upon those recommendations, the Joint Leadership Council will have an opportunity to review them, decide which ones we support, and that's going to start driving our business planning processes in the organization so that everyone will know the areas that we've decided to resource in the years to proceed, and will help us not just in our business planning processes, but also in the subsequent strategic planning processes that are involved. So I'll summarize that one with those specific details for all staff. We'll be having more detailed discussions with our clinical and administrative service chiefs as to what their expectations will be. Similarly, with our strategic planning processes, I talked to you in a previous video about our market assessments. So based upon your input, the first step is really to ensure that the market assessment discussions that we're going to have with VA's contractor really paint the picture of the future of the South Texas healthcare system as we would like to see it. And then from this point going forward, all of our strategic planning activities really should be focused on ensuring what we indicated we wanted our future to be are coming to fruition based upon what we're resourcing through our business planning processes that we talked about earlier. So you all told me these functions were disconnected, and we're going to do what we can to reconnect our strategic planning and business planning processes. So again, for administrative and clinical service chiefs, more to come on that. I also had quite a bit of dialogue from those who attended my transition briefings about our outpatient scheduling processes. I had a variety of opinions as to how to fix this issue. Obviously, I'm acknowledging that we do have a number of vacancies in our outpatient medical support assistants. There were some services who were interested in perhaps acquiring the outpatient MSAs and having them report to them. There were other services that maybe weren't as interested in acquiring their staff and maybe expecting the organization to ensure that medical administration service was appropriately staffed. So I've chartered our administrative executive board to put together a team that's going to include not just MAS, but all clinical services that currently have outpatient MSAs in their department. By May 6th, I'm expecting an assessment from that team as to, one, whether we should realign our outpatient medical support assistants to the clinical services. And if we do decide to realign the outpatient MSAs to the clinical services, what the resource implications of that are going to be to ensure that if we're going to hand the clinical departments this administrative responsibility, that we've given them the resources and infrastructure that they're going to meet, that they would need to make that a success. So I'll get that assessment on May 6th. We'll make a decision, and I'll provide you with an update on what that decision is so that we'll all know what's coming in the future. We also talked a bit about facility modernization. So a number of you told me about areas in the organization that you felt needed a facelift. I had a lot of comments from staff about who was in the facility, and maybe we had administrative functions in the building that could be located elsewhere so that we had adequate space for clinical functions. So we're going to be taking 2 different approaches to address your feedback related to facility modernization. First, I've charged our assistant director to work with HR and all services to do a 100% review for telework capability in the organization. I'm unaware of what the organization's past position has been on telework. Personally, I'm a supporter of telework, where it's mutually beneficial, beneficial to the employee, beneficial to the agency, and beneficial to veterans. And so I am chartering that by May 30th, we're going to have a completed 100% review of by service of positions that may be telework capable, with the primary focus of areas that we think will provide the organization with an opportunity to expand our clinical footprint. So again, there'll be more to come on that as that telework assessment is done and we evaluate where we think that space may be available, and then obviously letting you know which clinical programs will be expanding into that space should any be identified. The second is going to be a facility-wide beautification plan. I really want to give kudos to engineering. I've been really impressed with the engineering department that we have here, but also acknowledge that under their current resource environment, they're constrained with some of the beautification work they can do, because they really are focusing on some of the more critical systems and infrastructure, or Joint Commission or other agency findings, and ensuring that the agency doesn't have those liabilities, and so they're addressing those. But as a result of resources being sent there, we really don't have adequate staffing to address some of the things that you all mentioned: replacing flooring, painting walls. So I have had this discussion with our assistant director and chief engineer, and asked them to develop a resource plan for me to expand our in-house construction team, with the expectation that this fiscal year we will be funding at least one additional in-house project team, and I'd like to increase that to 2, with the primary focus of ensuring that not only can we address compliance issues, but we can also address some of the modernization and beautification comments that I heard from you all. So once I get that resource plan and can give you some assurance that we've approved engineering for an additional in-house construction team, I'll provide that feedback to you. Should be no later than the end of the month of April. So under your comments about succession planning, what I took away from that really was leadership development. And my sense in the organization, after interacting with all of you, is that we actually have pockets in the organization of services that have done a really good job developing leaders. So rather than reinvent the wheel, personally, I felt we had a lot to learn from, I'll use nursing in this particular case, as many nursing staff, either during my transition briefings or during my rounds, really talked about, not just during the Pathways to Excellence journey, but really prior to and since then, have really felt that service has given them a great opportunity to develop their leadership skills and capabilities. So I've asked our nurse executive to lead the effort to develop for South Texas a leadership development institute. She'll be partnering with HR and education and our labor partners to put together this academy that's going to have not just a kind of core supervisory training emphasis to make sure that all of our supervisors have certain core training that they're completing every year, whether it's on the master agreement or how to appropriately do fact findings, or when to engage the union in negotiations, but some of the other softer skills like how to improve communication and how to mentor staff. And so I look forward to Valerie's success there. I've been really impressed with what she's accomplished in nursing, and think we can apply a lot of that to the entire organization. The plan is to have a framework that's been approved by the Joint Leadership Council no later than August of 2019, and so that we can get this curriculum developed and the program rolled out for FY20. You also talked to me about the onboarding process, and I put this under the HR category that I heard from many of you. And some of you were frustrated with how long you felt like it took when staff were coming on board to get computer access when they joined the organization. So I have asked our associate director working with HR to do both a retrospective review of staff who've come on board. Let's figure out why they don't have their computer access by the time they're starting their jobs. I've heard of minor delays of a couple days to more significant delays of up to 6 to 8 weeks for employees to get access to the computer after we've already hired them. So we want to be certain that as an organization we're adequately using resources. It doesn't make sense for us to bring on staff, especially high-dollar clinicians, just to frustrate them and really frustrate ourselves when they can't get to work right away because they don't have computer access. So we're going to be taking a really deep look at that and ensuring we can smooth out that process. And I expect to get those recommendations on exactly what we're going to do to resolve that by the end of the month of April. But one of the other things we're going to do, though, based upon your comments about customer service, and specifically as it relates to HR, you know, what I reflect on as a clinical organization is that many of our clinicians have in their performance plans, I know I have in my performance plan, something specifically related to customer service. The veteran's perception of their primary care provider, the veteran's perception of their specialty care provider, the veteran's experience of care and mental health. But we don't always do a great job in some of our administrative departments linking our performance evaluations there to their customer perceptions. You know, how do our clinicians feel about the administrative services that are supporting them? So I've asked our associate director to work with our HR officer to develop a customer service element that's going to go into the performance plans of the appropriate HR staff, with the expectation that their performance plans are modified no later than June. And I chose June because that's going to give us at least 3, if not 4 months, to have that performance element there and to ensure it can be used in the end-of-year performance evaluation. But want to give our services some confidence that the input that they're providing to HR leadership is being used when they're providing those performance evaluations for their staff. I also look forward to seeing that revised plan, you know, being certain that the metrics are appropriate and seeing that deployed. You know, last but not least, under the onboarding process, one of the other things that we are going to be developing is a secondary new employee orientation specifically for our providers. You know, we are bringing in a lot of clinicians to the organization, but not really positioning them for successful use of our electronic health record, really putting the ownership of training doctors, social workers, psychologists, and others, putting the expectation on their services to train them on how to use CPRS. So just this week, I've approved 2 new FTE. Those are going to our health informatics section. They're going to be hiring those staff with a specific focus on training our clinicians on how to use CPRS when they come on board as part of new employee orientation, and putting them at ease before we put them behind a computer and in an exam room with a patient so they can feel comfortable. And so, you know, also our expectations for their productivity will be more realistic. So look forward to that with the expectation that we have that program up and going by the end of the fiscal year. Folks, last but not least was communication. I'll tell you, this one was difficult for me because the comments about communication were just really widespread. So there are a couple things that we're going to be doing that I'll share with you today to improve communication in the organization, but I'm sure there'll be more to come. First, obviously you're watching me on a video today. I'm going to continue to do this. I'll be releasing videos to you at least quarterly, updating you on things that are happening at the national level and at the local level. We're also going to be establishing a Speak to the Director program. This is something that I'm shamelessly stealing from Central Texas. They had it in place prior to me getting there, but it was an opportunity for employees to send me anonymous messages. There's an email group that was created. When the employees used the link to submit a message, their identification wasn't connected. It wasn't from their email account, but they could send me any questions that they had. I made sure that those questions were answered, and they will actually go on, for lack of a better term, a blog, so that everyone can see the question that was asked and everyone can see what the response was, to again improve communication and keep us all on the same page with what's happening in the organization. I've also asked for us to improve transparency of our governance process. I've already asked my office within the next 2 weeks to have the last 6 months of Executive Council board and committee minutes posted. I'll acknowledge when I went on the website and tried to look at our governance structure, while I can see the structure, there are locations for minutes to be located, and the minutes really aren't readily available for our staff to review. So I have asked that, to get us started, we're going to get the last 6 months loaded to give you all an opportunity to go in and at least see in our governance structure, whether that's the Clinical Executive Board, the Administrative Executive Board, Joint Leadership Council, Environment of Care, etc. You'll at least be able to see what the discussions are there, what's being voted on, what's being approved, etc. So I encourage you to keep checking our homepage, and you should see those posted. We're also going to be working really aggressively with public affairs to just get more positive media stories out. We'll be communicating those not just to external media, but also sharing with our staff, some of the good things that are happening in the organization. You're also going to see increased rounds. Just this week, myself and the entire senior leadership team had the opportunity to do some high reliability rounds together. Where we went to a number of locations in the hospital, talked to our staff there, and asked them, what they thought we could do to improve the safety of their work environment. And it was really refreshing to hear everyone give me feedback, whether it was the housekeeper on the unit, the unit secretary, the nurses, physicians, residents on the floors. So you're going to see more of that engagement, not just from myself and my leadership team, but there's going to be an expectation that your service chiefs and others engage with you that way as well. Last but not least, I want to be certain that we expand all staff meetings. So I'm going to be engaging with public affairs to see if some of the all staff meetings that we do, we can have subsequent all staff discussions with our off tours. So have some of those same conversations with our evening and night shift, whether that's in person or we allow those staff to interact with us in live Skype meetings, whether we're on station or elsewhere, but they can still have that face-to-face dialogue with us. So that's all I've got under communication, and it does wrap up my actions under the 180-day plan. As I indicated, for those of you who attended those meetings, I am going to be giving you monthly updates on this as part of my transition into the organization. So all the updates may not be in video, some of them may be by email, but I'll keep you up to date on a monthly basis as we close out the fiscal year. And appreciate you having me again as your Medical Center Director. I look forward to seeing you next quarter. Thank you.